Yes. I'm Sally. Hi. And as I've mentioned, I'm an occupational therapist. I also have Java Trainings, which is my website where I get to do trainings and consulting for all kinds of people. Right now, I work for a foster care organization, Community and Family Services Foundation, that is throughout Washington State. I do training and consulting for them and some clinical supervision. But you know what? I'm a mom of two adopted kids, and I'm a person who has gone through a lot of the stuff that, as I said earlier, why do we choose to do hard things? We're crazy, huh? But here we are. And I'm here to talk about secondary trauma, which can occur not only as a foster parent, but also as people who care. That was a big topic during COVID when we had people who were caring for lots of ill people and working hard. Teachers can experience secondary trauma. Anybody who cares about someone who is having who has had trauma, who's having trauma, and who is challenged with all of that. So that's what I'm here for. Okay, first of all, I like silliness. So um, it's just my little optimistic penguin there. Do make yourself comfortable. It's dinner time. If you want to eat, feel free. I have some strawberries and stuff that I may find myself popping one in my mouth. So eat, drink, and be happy, please. The first thing I hear is exhaustion. It's the first thing I hear when I'm doing consults is it can be exhausting. It doesn't just take your physical energy, but it takes your mental, emotional, and every other kind of energy you may have, right? And please, no condemnation, no judgment of anyone anywhere. But this is a different kind of exhaustion because you're in it to win it. Um, so look at that. I couldn't help myself for including this picture of but she looks so normal. How long does he have to live if somebody's medically fragile? Or, oh, so much pity. Oh, don't be so negative. You're overreacting. All of that stuff that you see on there. I bet many of you have heard some of those phrases. Or the one that is my particular favorite. Well, you knew it was going to be hard, right? Yeah, but anyway, people will say all kinds of things. Anyway, the things that I'm hearing, sheer exhaustion, grief or depression, the lack of support or appropriate support from people around you, and fear and shame is a strong word, but just like, I wish I knew better. I wish I was better at stuff, that kind of feeling. Do you know what I'm talking about? Why don't I have the answers? Good luck. These are complicated. I was just talking to Luann about how some of the situations are getting more and more complicated. So we got to have a definition when we start. The first definition, of course, I'm going to give you is it's compassion fatigue, or it's called vicarious trauma. There's shades of difference if you get into definitions, but I think they all, for the purposes of this anyhow, I'm going to lump them all together because I think they're all the same kinds of feelings of the stress wanting to help someone who's suffering. Whether, again, it's in a hospital, it's at a school, in your own home, any of that kind of stuff. It's really altruistic, kind, caring, and it's human to want to do these things in my way of thinking. And yet there's a lot of stress when there's a lot of factors going on. Now, this gal, okay, she's going to talk for a little bit. I'm going to give her about 3 or so minutes. If you like her, when you get the slides, you can go look up the whole thing. But, she has a lot to say, and I think the first 323 is good.
Thank you for tuning in for another video. Welcome if you're new here. Hello, my name is Kate. Today we're going to be talking about something very important in the foster care world, and that is foster care and self-care and secondary trauma. This is a subject that's not talked about enough within our agencies and our social workers. But if you don't know what secondary trauma is, and it's exactly how it sounds, but when you experience trauma secondary through, so it hasn't happened firsthand to you, but because of stories you've heard or things you've witnessed, that sort of thing, you experience secondary trauma. And the symptoms of secondary trauma are actually a lot similar to post-traumatic stress disorder. Some of those things are negative changes in beliefs and feelings and being in a hyperarousal state. And I talked about hypo and hyperarousal in another video, so if you want to know more about that, I'll link it up. Also, like an intrusive re-experiencing of the traumatic material, so playing things over and over in your head, not being able to get the images out of your mind or the stories out of your mind, and the avoidance of trauma triggers and emotions, just trying to avoid things and putting up a wall and not dealing with things. So these are all some of the symptoms of secondary trauma. So this is very prevalent in mental health care workers, in social workers, in first responders, in parents of traumatized children. So that would definitely include foster parents and adoptive parents. You can also see this in nurses and physicians who have to deal with particularly, gruesome things on a day-to-day basis. So why I want to talk about this is I think as foster parents, we think that we're the stable ones and we're the strong ones. And it's easy to
Thanks.
kind of forget about our self-care in it because caring for children that have experienced trauma is kind of all consuming. You think that you have to be the strong one all the time and you have to be their shoulder to lean on. But if you're not taking care of yourself emotionally to help deal with this trauma, then you can actually get in a very, very bad place. And it's so important. I think all moms need to have some sort of level of self-care because you can't take care of others well if you don't take care of yourself. And it's not a selfish kind of self-care and putting yourself first because I think, especially as foster parents, you don't put yourself first really ever. You're dealing with exhaustion, you're dealing with night terrors, you're dealing with emotional outbursts, you're dealing with mental health, you're dealing with their hard stories. I think the agency kind of tries to protect foster parents in particular when there's a really difficult story about a child and you don't find out all the gruesome and horrible details because secondary trauma is real and they don't want to scare foster parents away. Maybe, I don't know, but you do have to protect yourself a little bit and take the time daily to do a little bit of self-care, pray, talk to God, reflect on things. I think it's so important that you have that spiritual connection to help you to be emotionally and mentally strong to be able to care for these kids that have experienced trauma. Reading your Bible and doing a devotional and something like that in particular is just going to.
Okay. You get the idea. She's kind of hit the high points on that. Your spiritual care is up to you, obviously, but it's clear that this is hard. It's clear that most of us really have worked, so hard to keep things going in our family. And the secondary trauma it's a lot like PTSD.
Thank you for.
Say here a minute. I will get to that, but basically, there are two kinds of things that I think about when I think about foster parents. Is first of all, you can experience the secondary trauma of, oh my gosh, this child, what has they've been through? They went on a visit and they came back and oh yeah, the parent didn't show up, or they go to school and they can't really pick up the kinds of things that you would hope in their academic world because they've had fetal alcohol exposure or some other diagnosis, or they can't relate with other kids, all of those kind of things. So you feel that secondary trauma, like, wow, this kiddo really has been through a lot. And then you have the primary trauma, which is when your child is trying to cope and they start trusting you. Well, first of all, they have traumatic coping responses. Sometimes that can be stealing or hitting or shouting or some risky behavior, running away. All of those are, responses to not feeling safe. And then there's the other piece about primary trauma, which is the big, kind of irony of foster care. I'll get to that in a minute. I'll get ahead of myself and just say that primary trauma behavior could be a sign that they feel safe. So in other words, when a child, youth is with you and they're starting to feel more safe, they're starting to feel like they can be themselves, then they can release their big emotions. And sometimes those big emotions can be really negative or really sad or really even just anger or the kinds of strong emotions. And it looks like, oh my gosh, what am I doing with this child? Because they're just showing these big behaviors. And often, really, I would say often, this is because they've started to feel safe with the connection that they have with you. Try that on and see if it fits. And of course, there's no one size fits all. It doesn't happen all the way one way or another. But sometimes when they feel it, connected to you, you get to deal with the primary responses, which, makes you feel even kind of more confused because on one hand, you want them to feel safe, but on the other hand, these behaviors are really overwhelming. So, you really do have a real mix when you're working with foster kiddos. Okay. This is one of my favorite quotes, and it was just something I saw in passing somewhere. But to be immersed in suffering and not be touched by it, it's like walking through water without getting wet. Come on. You're gonna be touched by it if even you have a couple of brain cells that care. Okay? It's just gonna happen. So there you are. Here it is. What do we do? Okay. Now here's an explanation, just another overview sort of thing, but just to kind of nail it a little bit better.
Helpers that are exposed to others' traumatic experiences can suffer a very distinct impact, known as vicarious trauma. Different from burnout or compassion fatigue, vicarious trauma can significantly transform our worldview and disrupt our perceived meaning and hope. Experiences of trauma are inherently without choice. When we are exposed to this, our own sense of choice, control over change, and confidence that we can make a difference can be completely altered. Vicarious trauma may not deplete our energy, as burnout does. However, it may deplete or distort our sense of purpose, efficacy, and meaning, often to one extreme or the other. For example, we may have feelings of confusion or apathy about what is important. We may feel persistently on edge with anxiety, guilt, or helplessness, or we may have an overinflated sense of saving the world. As helpers, it is vital for us to recognize vicarious trauma and get support to stay healthy.
So she kind of talked about it. And also the part about, I heard the word control in there. I just find it so frustrating that I can't, not that I can't make things better, but that these things have happened to my child and she has had these experiences and there's, where do you go with it? How do you process it? How do you control it? How do you do, how can you manage it when I wasn't the source of it, but there it is. I kind of struggle with that and have for some time. So like she said, or someone said in there, it's like PTSD, but just a step away. So the symptoms can be the same as PTSD, that adults have, that children have. And it can be all kinds of sizes. It can be small stuff, big stuff, and it's all, like they say, it's all valid. But one of the things about foster care that's harder is you don't get a break. Yeah, you can get respite. We'll talk about that later. But for you, it's in your household. It's not like going to a workplace where it's hard and you get, kind of overwhelmed or whatever. This is in your home. And of course, kids just, hit a special place in your heart. So all of the time that you're seeing this, it continues to be in your home, in your face, in your whatever. Um, the other thing is, and this was a good quote I thought was great, is as we're moving into trauma-informed care, that secondary stress in parents, really there hasn't been a lot of research on. And I think it's super, once in a while you will hear about it with, hospital workers or people like that, but you don't hear a lot about foster parents. And I would encourage there to be more things that we can find for people to do or how do they, how to identify it, how to put it together, and coping mechanisms that we can find to manage it. I would love for the system to be different. But anyway, as far as how you're going to deal with the secondary traumatic stress, these are the things we can talk about. Right now, I can tell you what we know. I can't tell you what, other research will bring. But one thing I know about brain science, which is always really interesting, is that anything that's new, even if it's something to look forward to, even if we think it's going to help us, it's going to activate our stress, our am I safe system. Okay. Our default response, and this is from Bruce Perry and with that book he wrote with Oprah called What Happened to You, which is a really cool book. Anyway, our default response is, uh-oh, what's going to happen until the new thing is proven safe and positive? It will be categorized in your brain as a potential threat, right? Fight, flight, or freeze. And for most people, that's one of the major causes of feeling anxious or overwhelmed. Part of the reason that, remember COVID, where we didn't know. Remember the beginning of COVID, which is, coming up on, 6 years ago, at the very beginning when it was like, well, what is this thing? Is it going to be on my Amazon package? Is it going to be, can I go to a restaurant? Am I going to be safe? All those things, that unknown piece of that was just as traumatic as the actual, disease and learning about it. So got to throw that in that all of the unknowns that you run into in foster care. What's going to happen? Is he going to have, how's his visit going to go? Or is there going to be reunification? What's going to happen? A lot of unknowns. That's hard on your brain, no question. So then we have to recognize the symptoms. And how many of you are the one that says, I'm okay because I am? Anybody else feel like that? I do. Tend to drag it along until I figure I've got a back. One of my favorite expressions now is you have a backpack of unprocessed emotions. and you got to unload it somehow. Okay, somewhere, somehow. You may call a girlfriend, whatever. Okay, so blocked care, this thing called blocked care has become kind of the thing we talk about now as we talk about secondary trauma. And here it is where it's kind of like if you think about your breaker box and you're using a lot of power and it shuts off and the breaker stops. That's what I think of when I think of blocked care. I was trying to get a down to earth analogy, and that's what I kind of think about. So all of a sudden, you lose your joy and you shut down and only do the things you gotta do, not the things that are, what do you know, fun? Okay, so that's kind of how I look at it. It's the breaker box. Now, she has a couple things to say about it that makes some sense.
My name is Michelle Thompson, and I'm so excited to be here with you today to give you some strategies and support as we navigate caring for and working with vulnerable children. In this video, we will discuss blocked care and what to do when we run out of empathy and compassion for our child. All parents run out of empathy and compassion at some point. But for those of us that are caring for children that have come from trauma or hard places, it can be especially challenging to deal with rejection over and over. Your child has developed protective behaviors that kept them alive during unsafe times. But now in your home, these behaviors are preventing them from creating attachments and connections with their primary caregivers. This can result in rejecting behaviors and not reciprocating the love that is being shown to them. As parents, this can be quite the blow. Experiencing rejection after rejection can feel so defeating and even shameful. This is especially true for parents that are caring for multiple children. We can meet all of our children's needs, but we will eventually feel ineffective and completely out of empathy and compassion for them. This is called blocked care, and this is a very real thing. Here are some signs that you might be experiencing blocked care. Chronic fatigue and feeling extremely burned out, becoming very cynical to other people's helpful suggestions or ideas, feeling like there's a lack of empathy towards our child and not even really wanting to understand the whys behind their behavior. Losing compassion for your child is extremely shameful. It's very lonely to be parenting a challenging child, and it's not exactly something you want to share in groups of people. It's easy to be a connected, engaged parent with those children that reciprocate and that we generally get along with, but the ones that don't give that love and affection back, the spicy ones, now that takes work. That's hard. So we have two responses to this. We could throw our hands up in the air, claim martyr, say we didn't sign up for this, we don't have time, or
I don't like her guilt there. I don't like people when they sort of give you guilt. Skip over that part. She's just saying her opinion on this. And I just have to weigh in and say, no.
to engage, we could actually do the work.
So let's do the work.
We could get in there, learn the strategies, and choose connection with our child. We could do the work on ourselves and work on our triggers and our issues and be able to have that compassion and empathy that every child needs. There are several ways to combat blocked care. First and foremost, it's important to recognize that we need to let go of the shame. We are human and we are responding in ways that we know how to respond. And when you know better, you do better. Creating and establishing connection with my child is a must. Let's have some fun together. Let's take off the pressure of this relationship and just enjoy being together. We need to make a habit of connection, setting up points during the day to connect with our kids till it becomes second nature. I like to set alarms on my phone. In fact, I have probably 20 alarms set throughout the day to remind me to hug my kids, tell them something I appreciate about them, give them a compliment, turn on music, set a fun atmosphere, have a dance party. I set alarms for everything, and it becomes second nature to me. Right around.
Okay, I'm going to stop her right there because she has a couple of other strategies, but I'm going to cover them as well. The alarm thing, you know, really, if you can stop, push the pause button. I'm going to say that a couple more times about pushing the pause button. Really, I have a whole training on just doing little things to jar you out of the moment when you need to just take a break, hit the pause button. And apply some other little thing, whether it's smelling an essential oil, looking out the window, um, calling a friend, all kinds of things that you can do. But it's mostly about noticing and stopping. And sometimes having phone alarms set. How many of you guys set phone alarms? Come on, tell me you do. Just put your hand up. Yeah. Don't you set phone alarm for something? Set a phone alarm to give yourself a break sometime. Just a thought. And to make sure that you're still checking in with yourself, because that is important, I think. Okay. So here's another one, and you guys maybe know her, but she does a really good job here.
Well, that was really intense. I've never heard a child speak that way before. Okay. Oh, yeah. He calls me all the time. I just don't care anymore. There's nothing I can do. I want to tell you about this book that I heard about that might help with, what's going on with Kristen. Oh, we've tried everything. Nothing's going to work. It's just our life now. Yeah. I think this whole foster parenting thing is just not for me. At this point, I would do anything just to stop. Thanks for the invite. Honestly, the last thing we need to do is try to go to amusement park right now. I don't want to go anywhere. We're just going to stay home for the weekend.
So there's a list of some of the other things. And I really thought she was good, because you may have heard yourself say things like that, and there's no shame in it. It's just how it is. But okay, here. So did I go? I missed one. Yeah. So just to summarize, there's the shame because I should be doing better, and why do I not, feel all this compassion and things that I would like to do? You go down to just doing the basics. I'm just going to get them to school, going to get them home, get them food. Duh, it's going to be, there's a lot of individual variation. You would know that, but it depends on a lot, including, remember at the beginning when I was talking to some of y'all, I said I was born fairly optimistic. Even a little bit of old style parenting didn't kind of squeeze that out of me. And so my personality trait has made it a little bit easier. Overall health. Yeah, many, many people have some, health problems of all, levels, the whole spectrum of health problems that may contribute, mental, physical, whatever. Your previous history. Gotta say, that if you have had any kind of trauma in your past, if you've had anything of how you were treated, or just the kind of things that have happened in the bumps and grinds of life. Have you been through, some terrible fire or flood or some other trauma that has happened to you? And your personal history, that of course is going to have something to do with how you manage secondary trauma. And of course, bottom line, how much support and caring do you have around you? When you're on an island and you feel like nobody's around to help, that's pretty tough. That's why we have things like, trainings and support groups and all of those kind of things to remind you that this is not for the faint of heart. Fostering is not, even under the best of circumstances, even with, like what Sarah is talking about, sweet little kiddo, it's still a challenge, and it still changes your life in ways that, like it or not, you didn't expect. Okay, so I'm going to break it down a little bit here. First of all, cognitive indicators, your brain, the higher level functions of your brain, which we all hope we have. Lowered concentration. When you're feeling bad in the back of your head and you're preoccupied with some of the traumatic things that have happened to someone, your concentration isn't going to be so good. Inflexible thinking. The mark of a well-developed brain is to understand the gray areas. But a lot of times when you kind of go backwards, if you will, you see only one side or the other. You don't see the many nuances, or you do see the many nuances, but you can't get yourself to kind of come to a conclusion or manage it. Okay. Just as I said, the preoccupation with the negative, like that lady who was in oh no, we just can't go out anymore. We don't have fun in our household. So that's the way you think. Of course, irritability, cynicism, apathy. Those are the things that if you catch yourself doing that, and I don't mean, once in a while, I mean often, frequently, for 2 weeks, basically, a whole lot of that. You can have little bits of it too. That's typical. But when you start feeling like that's happening for a little bit longer than it should, that's a cognitive indicator. Of course, emotional indicators. You don't need me to tell you this. The feelings of guilt, like I should be better at this, but oh, and I'm angry. I'm so angry at what, oh man, when my 12-year-old daughter told me some of the things that happened to her by from her previous adoptive parent, how she pricked her fingers with needles, how she starved her, how she made her kneel on a washboard for hours, how, all of those kind of weird, kind of mentally ill kinds of things that her previous adoptive mother did. I got really angry, and I actually had to watch it in front of her but it was a previous adoptive, not a bio mom, so I could have some other things to say, but nevertheless, I was angry. And sadness, how could this kiddo be treated like, sadness. And then sometimes you feel just numb, like I can't, no, I cannot deal with this anymore. And that helplessness and anxiety. What's going to happen next? How, that's that brain trying to say, what's unpredictable? All of this is unpredictable, and I'm anxious about the future. You guys know what I'm talking about. I said at the beginning about exhaustion. I think that's the number one thing I hear from consults is just that people are kind of tired, just tired and exhausted, even if you're getting all the sleep that you could. Sometimes in increased heart rate or physical kind of internal symptoms, the aches and pains. You may already have a bad back, but it feels worse. Those kind of things just seem to be a little bit amplified. Again, this is PTSD, but secondary. Shortness of breath happens sometimes. And again, I'm trying to point towards the increased severity of medical concerns, even if it's something you've already had before. Things just are again amplified, blown up a little bit. And then behavior changes. And notice this is a kid-looking poster, but it has adults in it. So yeah, over planning. Anybody do that one? That's my way of dealing with anxiety sometimes is trying to hold on to everything, which often you can't do. And avoidance, having the kiddos avoid things. Withdrawn from previously enjoyed activities. That sounds like depression to me. Sleep disturbance, having trouble sleeping, the hypervigilance. You're always watching waiting for the other shoe to drop is what I think of with hypervigilance with parents in these situations. The elevated startle response because your brain is expecting something that's fearful or scary. You may have appetite changes. Some people eat more, some people eat less. Obviously, we talked about anxiety. The dissociation, I don't mean dissociation like, that kind of dissociative disorder as much as I just mean you back yourself off from things. You're kind of taking a step back and you're not involved in your interactions at home. You're just doing what has to be done and you sort of not associated with emotion being part of it. I hope that makes sense. But yeah, just kind of backing away from the things that you might have been involved with before. I saw this one and I don't know if I agree with every single one of these, but suspicious and this is your brain on trauma, suspicious and untrusting, maybe addictive, like, you go for things to help your brain check out, self-sabotaging, distracted, self-critical. I know how to do that one. If you guys know how to do that, I'm really good at that one, okay? Or judgment of myself or others. And emotionally cut off, that's what I'm trying to describe about the back off when you're not really, you've kind of dissociated in the sense of you're not participating in your own full life is maybe the way I would say it. So these are all the things. And here's the thing you've got to remember. So many of us have some kind of unresolved trauma. And since many people in here are women, remember when the Me Too thing came up and all of a sudden, all of us started thinking of, oh yeah, I did have that thing happen to me. I had kind of suppressed something that happened to me when I was in high school, when I was doing a job and I was in a nursing home actually, and a guy kind of pushed me in the stairwell and tried to kiss me and stuff, and I was 17, and I hadn't thought about it in years. Did not think about it in years until it came up more recently, and I went, holy smokes. Sometimes when you see something where your foster kiddo has had trauma or something about it, you may find out that, brings up some things for yourself. Shoe fits, wear it. If it doesn't, throw it out.
Parents with unresolved trauma have obviously, with all of these changes from their own past, more difficulty responding appropriately to high stress parenting moments. They may find it harder to modulate their own anxiety, their fear, and their overreactivity in stressful parenting situations.
And often parents who have unresolved trauma, they're out of sync with their kids' needs. It's hard for them to soothe their child because they're so busy soothing themselves. So think about it this way. If a mom has had a lot of adversity in her childhood, is on a playground with her kids, and her son comes running to her and he says, Mommy, Mommy, that boy hit me. A mom who's had a lot of adversity might overreact. She might take her kid, haul him by the hand, run over there and tell that other boy, you leave him alone or I'm going to smack you. You know, could be a big response because it feels so scary that something could happen to her kid the way things happen to her. Or she might underreact or what we call overmodulate her response. And she might not say anything to her son or to the other boy. She might not explain anything. She might be so emotional, so affected that she's in tears and she can't modulate the stress that she feels in this triggering situation. So she's weeping and she just drags her son home and doesn't say anything. She's managing her stress response and she's so busy being flooded by her own reactivity that she doesn't respond to what her child needs. She's out of sync. And kids learn, hey, when I'm really stressed, mommy can't help me.
Yeah, now that's a pretty extreme situation she's describing, but I do think it's worth, examining. Hopefully, none of you have had the level of trauma that she is describing. That said, it's always good to kind of examine your past, how it may be affecting your kiddos and your ways of managing their trauma.
Parents
So, what are we going to do? Top ways that I can think of, and there's all kinds of others, but these are, the things that I use with the secondary trauma. And the first thing that I would say is recognize it. Know what you're dealing with because you can't, if it's floating around in your head, as I tell my kids, when it's a ghost in your head, you don't really know how to grab onto it. So we want to try and recognize if you have aspects of that and what might be helpful for you when you're trying to deal with this. So that's the first thing. The second thing, oops, I didn't mean to do that. Sorry. Second thing hello, I went too far. Sorry, I hit the wrong button. Now come back. Yeah, here we are. Anyway, yeah, the first thing is the recognize. The second thing is what I call name it to tame it. And it just means that when you have, with your kids and yourself, when you say, oh, this is what's going on. This may be a secondary trauma thing. I'm noticing that, I'm really increased a lot in irritability, not just the usual little irritability, but things are making me really fly off the handle. I'm not really managing this well. Name it. This must be a lot of irritability. I wonder if it's secondary trauma. I wonder what's bringing this on. The next thing is to validate it. This stuff is for real. It isn't pretend. It isn't, as I said, we guys here have decided to do hard things. Validate that these feelings, this stuff, it's not atypical for people to have it. And yeah, reach through the mirror and give yourself a hug there and respond with some self-compassion. Don't expect if you guys are perfect, I'm not going to like you. I think we need all to be giving each other the grace and understanding that nobody gets it right all the time. Nobody ever. And to do your best and to shoot from the heart while trying to learn about yourself, to me, is the best thing you can do. And the whole self-care thing, which we'll talk about. If you start to see something like I was just describing, the increased irritability or something like that, that seems it's different for me. I'm not normally like this, or this is worse than it was before. The back pain, the depression, whatever it is that you're dealing with. If you start to notice, yeah, this is another level for me. Get in and talk to your care provider, please, because sometimes there's something medical going on, just like you would with your own child, and discuss if there are any options, if there's anything that's going to help you feel better. And I don't always mean medication, it may be some other kind of thing, but know what's going on. Again, to accept it, to, recognize what's going on. Good to have a partner with that. And then how do we find our way out? That's the point that I want to get. How do you find your way out? And then realizing that some of our reaction to our kids, not all of it, but a lot of reaction to our kids has a lot to do with how we're feeling, where our window of tolerance is as much or more than what the kid's doing. A lot of it is our window of tolerance because you know very well that the same thing will affect you. Your child may do something. I'm not talking the serious stuff, but I'm talking about your child may be, giving you some sass. And one time in a day, it might be okay. And another time, it's like, I can't handle this, and you react. It has to do with your window of tolerance, right? So, what makes our window of tolerance be more open? It's that main job for us as parents is to be physically, mentally, and emotionally healthy. And not trying to lay on another trip because these things can be done in little bits, little tiny bits all through the day, little things that you can do to keep building yourself up and helping yourself to be as healthy as you can be. Like I said, nobody gets it right all the time. Please don't. But to be aware and to keep yourself in a state that is functional. Occupational therapy, by the way, should be called functional therapy. We're always looking to get to the best level of function we can get to. And this is about what's functional. And again, some of it is instead of saying, I am freaked out, I'm overwhelming, if you can go, let me prioritize. I can't tell you how many times I've said that in consultations. Let's hit the pause button and think about some priorities. What's the most important thing that you can do? This and this and this. It's going to help you and help your child. Okay. Just say, I need to focus on what matters most and go slowly. Good picture too, by the way. Okay, and this is what I say in this one too. It has a little thing here that says do nothing for 20 seconds. Now, I would say that if you're standing in the middle of the street with your child and a car is bearing down on you, do not take that advice. Otherwise, though, I think we live in such a fast-paced world. Maybe that's because I'm old, but I think so many times if we can model for our kids, wait a minute, let me think about that. Hold it. We aren't going to make that decision right now. Give mom a couple of, chance to think about it. I will get back to you. Some of that stuff of just taking things slowly. Also, we know that slow, deep breaths are going to improve your thinking. It just gets you more oxygen, along with, straightening up and a lot of other things, because so much of the time we spend over our computers or over our phones. Move your shoulders back. Take a couple of breaths. Sometimes distracting yourself until you're calmer is a really good idea if it's, if the situation allows. I remember one time I was going to do a training at a school and our water heater broke. And I'm like, oh, geez, what am I going to do? How am I going to fix it? How am I going to get the guy to come out? And just stupid stuff like that. And I'm thinking, I got to get to this class. I am just not going to think about that. I'm going to distract myself with this class. I'm going to go do that. And you know what? After I did the class and I came back, I was a lot calmer about dealing with the water heater thing. So sometimes it helps to hit that pause button and say, I can't do this right now. I will get back to it. I realize situations with kiddos may be more demanding, but I also kind of think if you can, just remember to go a little more slowly. Another thing that, I'm a somatic type therapist, I'm going to say, do a little stretching before you have to answer something. Move your arms and legs around a little bit. Give yourself a palm press, a chair push up. Give yourself a little bit of deep pressure because that's the go-to for occupational therapists as far as helping with calming and organizing behavior. Also crossing midline, which I just did by taking something from one side of the body and the other and crossing because that helps both sides of my brain function better. Okay. Just these little physical moves. And again, they help you stop and not do things where you feel like you have to do it right away. If it's a situation where you can talk to somebody you trust and I mean, I did that with my daughter this afternoon about a situation. My older daughter, I called her and I said, hey, this is what I'm thinking about this. Am I off or not? And she said, yeah, you're overreacting. Okay. Okay. I take her advice. I appreciate it. That's what I called for, even though I still think maybe I wasn't. She's like, okay. And it was only a, 2-minute phone call, 2-minute phone call. I got this from a teacher for permission slips. What do you need to give yourself a permission slip for? Write yourself out a permission slip. I have permission to go to bed 1/2 hour early, regardless of what's going on. I don't know, whatever it is that you would like to have permission for. I have permission to have somebody else help with dinner tonight, whatever it is. But I like the permission slip technique. And like I said, teachers are giving out permission slips. Why not, give yourself a permission slip? I need a break. I also love this slide because don't you feel like this, guy? Some days you want to hide under the blanket, and the other days that you're wearing the superhero cape. So many of us expect too much and we don't tune into our own needs. And I know, oh yeah, well, I've got 4 kids and they're running around the house and all those kind of things. I get that too. I get that too. I understand. But if you can at least be realistic and kind to yourself, it's going to make a whole lot of difference in how you approach others. And it just is. It just is. You got to give yourself some slack. The other thing is, as a therapist, I got to say, these are mental health interventions. When I was working in the mental health unit at St. Joe's and St. Francis hospitals in Tacoma and Federal Way, Washington, one of the things that I would do when I was having patients being discharged as, as a therapist, would say there are 3 things that I think are super important as you're being discharged. Now, you guys remember, these people were an inpatient. They were, presumably wanting to hurt themselves or somebody else or had some other really significant problem. It was acute care. And the 3 things I said when you're going home, a lot of depression was, first thing, please have 15 minutes a day of some kind of movement, stretching, strengthening, walking, anything, 15 minutes a day. Secondly, have 15 minutes a day of being outside. Now, I realize we've had a whole lot of rain here in Western Washington, but if you can get outside and even sit and watch the rain come down, there's something about being outside. Remember, I was working with a lot of depressed people who were staying inside all the time, but get outside. Just get outside a little bit. Some of you are doing far more than that. Some of you are doing far more of all of it, but minimum 15 days a day, 15 minutes, excuse me, a day of stretching or moving, being outside. And the third one is music. I really think it's important to listen to music every day because it changes your brain. You know this, and it can be loud, quiet, soft, as long as it doesn't hurt women, I'm all over it. Any kind of music, those 3 things. And if you're really in a hurry and working really hard, if you can get around the block for 15 minutes with your earbud in outside, you got it all done in 15. So these are things that I think are really important interventions, in addition to what they say here about a safe relationship. And I hope all of you have some safe relationship. If you don't, we need to talk. Okay. Here's my pause button. I talk about it a lot. Having that self-awareness. Sometimes think about what you think about. If you can, take a minute or two, even right now, to think about, what fills your brain? Because one of the things I do when I'm talking to, like high school students, I do that, is the seeds you plant. What are you exposing yourself to? Because whatever's in your brain that you're planting, it's gonna grow if you water it and if you feed it. So the things that you keep coming back to are what's going to occupy the space in your head. That's part of the reason for the music, okay? And what kinds of things, it's just like what you think about your own kids. If you notice a difference, for example, when they watch a particular show or when they are with a particular friend and you see the influence that that has had on them. Okay, all this stuff's influencing us too. Our brains are just like that. Whatever you plant, it's going to grow. So please, please, please take time to think about what you think about. I've noticed that I like to listen to podcasts, and I notice I've gravitated toward a different type of podcast than I used to. I like true crime and all that stuff, but it was starting to, I kind of went in a different direction. Think about what you do and remember that, it's where you live, so you better plant good stuff. And you have some control over that. Okay, you don't have a lot of free time in terms of you're taking care of kids a lot, but in what's your mind, what's it dwelling on? Take a minute sometime to pause and think, what do I often think about? What am I curious about? What's interesting me? And it could be all about childcare. It could be all about childcare methods. It could be all kinds of things. But again, it's worth thinking about because it's, what's growing in your head. These are the skills I hope that we can all develop, and I'm working on them all the time. Okay. Modify my own negative self-talk. Huge, huge, huge for me. I've had to do it for a long time, and I keep on doing it. I mean, I'm not going to say I'm, getting better in every day and every way because that doesn't work for me. But I often used to say to the mental health patients, if I can shake hands with myself today, if I can say, okay, you did all right. It doesn't have to be, perfect, but I did okay. I can shake hands with myself. Knowing your own emotional triggers. Oh my goodness. Have you guys, I mean, I'm sure there are some of you that when your kid drops an F-bomb or your kid is sassy, disrespectful, or they are, depending on all the ages that you have here, but lying. which is not atypical for foster kids because they are trying to still be connected and appeasing you. But if they messed up, they're afraid what you're going to do. Okay. They were afraid of the consequences. So a lot of these triggers that you have. I'm trying to think what my triggers have been. Definitely don't like disrespect. Trying to think what other things the kids have ever done that, yeah, snippy voices don't do well for me. And again, I have to be really aware of my own triggers and decide, is this worth taking on or not? So, not personalizing it. So much of the time, oh, I have a wonderful phrase, something about that. So much of kids' behavior has to do with if they are feeling, if their physical, mental, and emotional needs are being met in the moment, and if they're feeling safe. So it almost has nothing to do with you. Maybe what environment you've got them in, but it's really so much of it isn't about you and just how their internal system is working, especially when they're really small. But for sure, don't personalize it so much. It seems like it's about you. Excuse me, but it's usually more like it's about the kiddo's internal state and bottom line, if they're feeling safe. So if you can if you're going to, back away from something, it's not to personalize the things they're doing so much. Accept support. How many of you guys like, oh yeah, everything's fine. I'm okay. Yeah, I'll check in when I need it and try to do it all like this, the gal with the superhero cape. Okay. I struggle with accepting support. I confess I do because I'm a caregiver. I'm supposed to do all that, right? Huh. Accept support when you can, even if it's just little things like letting somebody unload the dishwasher, whatever it is that you do. And then body, body, spirit, mind, self-care. Um, it always comes back to that, guys. I wish it didn't. And everybody's so tired of hearing about it and rolling their eyes at it. But if you can make it real for yourself, it's going to be so, so, so much better for you. I promise. Um, and Bruce Perry, one of my favorite people in the whole world in terms of the trauma world, he put occupational therapy on the map because he said that rhythmic movement, patterned, repetitive, rhythmic, somatosensory activity. And I saw it when I was working. I didn't mention I worked in pediatric clinic and supervised it. I owned it and worked with a bunch of therapists. When I started to see how some sensory activities, swinging, jumping, rocking, all of those kind of things that we did, oh God, obstacle courses and all the stuff that you do in sensory therapy. And I could see my whole caseload was pretty much foster and adopted kids. And I could see how much safer they felt in their bodies when their sensory needs were being met. It was like miraculous. It really was. It didn't happen right away, there was no magic. But when I could see those kind of rhythmic, repetitive activities, like I've listed here about walking, running, dancing, drumming, and well, Bruce Perry said it, singing, repetitive breathing. One of the stories I can tell you is I remember one day we had a squeaky copy machine, and it was squeaking loudly, and it was annoying as can be. And in walks a really cool foster to adopt mom, who was also a nurse. So, of course, I loved her. And she had special needs, definitely almost medically fragile kind of kiddo who came in with her and been coming to us for just a little bit, maybe, 3 weeks. And I knew as soon as they came in that Corinne was going to have some kind of reaction, and so did her mom. So the noise, it really was annoying. So there are four things, well, maybe four things her mom could have done. The first thing is she could have walked out and said, uh, I'm coming back in when that machine stops. Corinne is not going to handle this, which would have been a perfectly adequate response. She didn't do that. The second thing is she could have said, could you please turn that thing off while we're here or until she gets into the back so she doesn't have to deal with this? An absolutely appropriate thing to do. She didn't do it. The third thing she could have done is knowing that Corinne had auditory sensitivities or was, kind of didn't feel safe in a lot of circumstances. She could have had headphones or some other distracting thing, noise canceling, whatever. She could have done that, but she didn't do it. What she did was she brought her in, she sat her down, she had said, look at me right here, and she gave her wrists a good significant squeeze, gentle but significant enough that she felt it, and said, breathe with me. Let's breathe together while this noise is going on. And I say yay, because that helped teach a coping skill to Corinne and was part of the therapy that she was there for, is a little bit of desensitization. Because you know what? There are going to be loud, annoying noises out there. And while I don't expect her to walk outside in a thunderstorm or something, there are going to be times when you want to prepare a kid. So that's what we were doing in the therapy, was some of the auditory desensitization. Isn't that so cool? I just think that's a great story because it can be done. And these kind of things, when I was working in the pediatric clinic, I just thought it was so cool that this rhythm, the pattern, repetitive. I mean, when you dance with your kids, or, oh, other story, if you can stand it, and we do have time for it. If one time I was watching one of my therapists who really wasn't, a lot of occupational therapists are not trauma integrated. It's one of the things that is, I'm on a mission to make everybody trauma integrated. But she was drumming. Gosh, it's getting dark in here. She was, I don't even notice these things anymore. She was, I still don't like it. I'll stay in the dark for a minute. She was drumming on a stability ball, those balls that you sit on and everybody exercises on. Okay. She had a couple of drumsticks and she's drumming a pattern with a kiddo, and he is drumming back. Okay. And she's drumming a pattern and he's drumming the pattern back. Okay. Drum, drum, drum. What she didn't know she was doing was helping him feel safe because it was patterned, repetitive, rhythmic, somatosensory activity. She's just thinking she's working on auditory processing, which is great, but she's also working on helping him feel safe in his body. Is that not so cool? So, some of these things that you think, you're just doing whatever with your kid are actually making them feel safer, and rhythm regulates the brain in like the most cool way. So, do the little drumming thing on your desk or whatever. You don't have to have drumsticks. It works. Um, Other ideas. Obviously, I'm an occupational therapist. What do you think I'm going to talk about? Is different sensory things. I have found the research, it does say you listen better when you're drawing. Now, I'm not saying that if you get deeply into your drawing, you're not going to be listening so well, but a lot of people doodle. And I've had to talk to teachers and say, look, just because they're not making full 100% eye contact with you in the classroom and they're doing a little doodling, as long as they're not, again, getting absorbed by their drawing, let them doodle or let them play, doing something with their hands. That's the whole fidget thing, is it helps kids focus. Not everybody, you got to do it case by case, but it does happen that you can listen better, okay? Try singing, even if you can't sing. Try singing with yourself and your kids. It's kind of fun and it's kind of goofy. And how many of you, please tell me the truth, have not stopped things, I hope, and done a dance party once in a while? Please tell me you've done a dance party once in a while. You don't have to, but it's one of those things that, again, I'm going to have to turn on the light because it's starting to get so I can't even see what I'm doing here. Ugh, so overexposed. Anyway, you will have other ideas for yourself. You know what the sensory things are, but it isn't just for your kid. That's what I'm trying to say. It's not just for your child. It's for yourself. Do anybody do crossword puzzles? Anybody do word finds or Wordle or those other things? I'm not saying it's going to change your life, but if you like it and make time for it, it's going to make you feel like you're taking care of yourself just a little better. Like I said, it doesn't have to be big stuff. Just little things can make a difference when you intersperse them throughout the day. Even nature sounds. This guy, Dr. Joe Dispenza, he's written some really cool, interesting books about the brain. And he's saying 2 hours of nature sounds. Now, I don't know how he figures out how it reduces stress hormones up to 800%. I'm always suspicious when I see big numbers. But what's the downside of trying, right? Nature sounds. Put them in the background and see what happens for yourself and your kiddos, right? Ah, and I do this as a lifestyle. Since I read about it from Dan Hughes and his ideas about how to attach. I started doing it when I was working in pediatrics, and I think I kind of do it with my husband and with my kids and with everybody else. I tend to approach people with playfulness. I don't always, but I tend to, kind of be lighthearted, kind of talk in a gentle and kind of fun way with people, especially when I first get acquainted. And then the acceptance part. The acceptance doesn't mean you accept your kid's bad behavior. It means that you kind of accept that someone else is going to have a different viewpoint. Your child, whatever age they are, is seeing it through their child eyes. And whether you obviously there's some things you want to change if they're, misbehaving, but to accept how they see things, to accept their perspective, and then to kind of appreciate where they've come from. I know you guys all do this, but I tend to start with playfulness because it lowers people's cortisol. And so even when, I meet a new person, I may make some little joke or I may say something because they see me as not a threat. And I don't want to be a threat. I want to just have connection and interaction. So I kind of try to lower any kind of stress or pressure by being a little lighthearted. So playfulness and then acceptance. And with acceptance goes, well, why do you think that way? What made you get there? Um, just dumb stuff like, we had a kiddo on the autism spectrum who was deeply into birds, of all kinds of birds, and he was really, really interested. And I was curious. I was like, how did you start doing this? Where did this come from? What kinds of birds are your favorite? All of that kind of stuff. That curiosity is such a gift to your kiddos, any kiddos, actually anybody, because they're like, wow, that person took time to ask me questions about my interest. That's pretty cool. And especially when it comes sincerely. And then, of course, empathy. And I throw in forgiveness because one of the things that, we learned in parenting, it's better to have a relationship than to be right all the time. And I mean that with small things. But, I know a lot of parents that just feel like hard line, we have to be right. Uh-uh, you don't. My kids have grown up knowing that their parents make mistakes and sometimes need a do-over. Hit that pause button and say, wait a minute, can I hit the pause button? I need to do a do-over. And that models it for them. And it usually means that you get more respect, at least in my world. So I'm going to hope that that is true for you as well. It's okay to say you're sorry. Somebody really smart told me once that the best way to parent in general, high structure, high nurture. And sometimes the structure overdoes and sometimes the nurture overdoes. But to have that kind of a balance with it seems to be pretty useful as far as the way that I have seen parenting work. See what you think. Because again, it's no one size fits all on this stuff. The other thing is back to playfulness. People in, corporate world do a lot of, kind of group activities that are playful, or they'll, I've got a daughter of a friend who works at Amazon, and they have them going out and socializing and doing things at, with them paying so that they have some time to get away and do some playfulness. It's healing, and it even increases immune health according to this. So I'll go with that. Why not? You need a little bit of playfulness. And again, to have that moment of rest, that moment of, silliness. And kids love it, by the way, even if they're older kids. I used to tell dumb jokes to middle schoolers and they would just roll their eye. I would get just the, what was it? What do they call that? The, not the eye roll, but it was more like a stink eye. That's what I got when I was telling dumb jokes, but just silly stuff that would make them connect with me. But more than that, it was fun for me. And that's where I'm going, not just with the kiddo, but what's fun for you? What do you do? What did you like when you were younger? Is there any way you can get any of that back into your life? Even if it's just watching a YouTube video about it, just something that's fun for you. That's how you get reconnected. Um, and again, I keep coming back to this because maybe it's my, research is me search, but don't feel guilty. Let yourself off the hook because forgiveness begins at home. Start telling yourself, you don't have to be perfect. You can say you're sorry. You can make mistakes. And like I said, I like humans and all of us do make mistakes. And then there's the gratitude thing. And that got popularized so much that now I feel like it's kind of over popular. But I do know that a brain that is thankful, many studies, people who count their blessings, this is from somebody, he was where was he? Georgetown or someplace, talking about the studies. People who count their blessings are experiencing less depression. And sometimes, we're writing it down. Sometimes it's so hard to see that. I mean, if you flip the switch in the breaker box, it's awfully hard to see what to be thankful for. But everybody who's here, you have a computer. That's something. Everybody who's here probably has enough food for dinner. And I'm telling you, I've been to Africa, I've been to places that it's not always the case. So I don't want to say like, we all should feel bad for other people, but you got to remember there are so many blessings in our lives. And the fact that, you've been able to share your blessings with somebody in your home makes me really so thankful for you, really and truly. Here's the other thing. So many of us, and it is so easy to do, draw conclusions based on unwarranted information or undocumented information. In other words, labeling. You look at this kid in the picture, and you think, what's going on? And so many people might look at that and say, well, he's angry, he's being sullen, he's got his arms crossed, whatever. And I'm thinking, well, you don't know. You don't know what's going on because all you know is what I call the movie camera technique. If you use just a movie camera as you're watching situations and reading, trying to understand body language, you don't always know. You don't always know what these guys are doing. And even though past experience may tell you or something else, I like using just the movie camera, not drawing conclusions, not labeling, and just saying, wonder what that's about. And if I, have the kind of relationship, I can kind of go, hey, I'm looking at you. Now you got your arms crossed and you kind of have your head down a little bit. What's happening? Or just feed it back if you need to communicate. But no negative predictions because a lot of our brain wants to do that. Our brain wants to categorize and predict. And I'm suggesting you try to override it a little bit and just observe. Just observe. And then you will get to probably a better answer and a less judgmental one. And because sometimes you can jump to conclusions. I've certainly been known to do it. The other thing is when you think about the phrase that I heard about when kids are, seeking attention at some level, they're looking for something from you. I like to think they're looking for connection. They just don't know how to do it. So a lot of times and again, sometimes it's not about you. Like I've said, a lot of times, sometimes the kids' reactions are not about you. But sometimes when you see some of these behaviors, they may be looking to you like, I want to connect. And I want your attention because I want something from you. Sometimes it isn't easy to tell, if it's just something going on with their brain and not about you, and other times when they want to seek your attention. But I think, you get to a point where you can use your movie camera technique and kind of see what's this about? What is going on with this kiddo? And again, it comes only when your window of tolerance is fairly high, which means that you've been taking care of yourself and you're not going off, to do the labeling first, right? It takes a little like hit the pause button thing again. The other thing I know works for me is I have a tendency to think, well, today I got to do this and this and this and this and this and this and get ahead of myself or get days ahead of myself sometimes. And for me, I have to shrink my sense of time down. Sometimes it's kind of like the Alcoholics Anonymous thing where, one day at a time, except like 1 hour at a time sometimes. For me, that works in order to not get ahead, not get anxious about something that's coming later, and to focus on the needs right now, my needs right now, not even the kids' needs, but my own right now and the concern of this moment, because I have found you can't, heard the phrase, stress yourself to a solution. No, best way to do it is to focus on your needs right now. Now, one of the things I didn't put in this slide deck, but I would love to suggest, if you can, sometime during the day, I took a class on mindfulness from a friend who's really good at it. I think it would be really worth your time. Get on YouTube and find a script for mindfulness, like a body scan. You can do it for yourself. I would strongly recommend you do it for yourself. Sometimes people do it with kiddos too, where it's just, 15 minutes or less, even 10 minutes, where you sit there at your computer if you want, turn the YouTube thing on, and they do just a really quick start at the top of your head or your arms or any place and go right down and just say, okay, breathe into that area, focus on that area. Yeah, you may hear other noises or whatever, but you can turn those out. Just focus on this thing and do a mindfulness thing. It doesn't take long for those, different times that you set your alarm. That's one of the things you can do very quickly. You can also have what I call the, 3-minute phone call, short phone calls with a friend. These kind of things do break your day up so you don't feel like a robot taking care of children. And that's what blocked care is. So if you can intersperse some of these little things, I do believe it helps you get past it. Okay. Those are the things that I know work for me. And, I've researched it and that's kind of what comes out. I love this video, this graphic, because I also know that when you're trying to take care of somebody, sympathy is looking, over the top and saying, oh, I see that, that's not great. Over identification. I have worked with parents who do. It's kind of like the lady in the video said, who over identify with their kids because of their trauma or because of their past. And oh my gosh, I'm involved in a school situation where there was a mom who was pretty highly acclaimed, and she was a physician whose child really wasn't, he was a bio kid too, and he really hadn't been in trouble much. He was a really nice kid, but he screwed up and he did something to, I don't know if he hit another kid or he did something inappropriate with another child, to hurt him. Either, I mean, it might have been feeling hurt too, said something. And this mom blasted the principal and said, this could never happen. My child never did that. And, there was, I mean, it was six something. He could have never done that. That is not who he is, blah, 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 blah. The principal had no reason to bring this up if it hadn't happened, if this wasn't the report, if it wasn't what she heard from both of the kiddos involved. But the mother was so into the over-identification, I think she pulled the kid out of the school. And it's like, whoa, okay, it isn't you, it's your child. And yes, they do behaviors. They learn that way. If you hadn't noticed, a lot of us learn through mistakes, right? So the over-identification is something I do, run into once in a while. But the empathy, there you are. You're still grounded. You're still holding on to that root, and you're trying to help the kid up. And you can't do it unless you have that root firmly in hand, that you have your own care taken care of first. But you got to set some boundaries and not dive in there with them. Make sense? I hope. Okay. And then there's respite. A lot of people have differing opinions about respite. I've had parents tell me that the kids come back more dysregulated from respite. I've had people say it's the best thing that ever happened, and I've had everything in between. Okay. But sometimes a break is a good idea, so you can offer your best parenting self to the kids and families. I recently did a consult with a mom who, single mom, who had to use respite because the child had done something that was so egregious in her way of thinking. It wasn't anything that harmed anyone, but it was against discipline, and the mom was so kind of triggered by it for whatever reason, no judgment, that she really had the kiddo have respite, and it really worked out well for him. For other people, not so much, but I would love to suggest that respite is important in whatever way that you can make it happen, because everybody needs a break sometimes. And large and small. And I like this little thing about you can't run away to a cabin in the woods, at least try to read a book in the bath, go for a drive, listen to music, try to get peace in the midst of the crazy. That's what we're all going for. And sometimes, think about what you can do to make respite happen in however you perceive that to be working in your household. Okay. Are there any support groups in your area? There are some online things I've thrown up here that I have seen. I don't know what you guys, how that works for you. Um, and here it is. Yeah, the 8-minute phone call. Mine are sometimes only 4 or 3. But what can you do? Or just have, friends, understanding friends. It's always got to be understand, not the girlfriend who knew you before foster care and doesn't understand why you did it. But some like-minded people can really give you a boost when you need it, regardless of how you look at that, whether it's support, respite, whatever it is. See if you can make it happen if that sounds right to you. Okay. And savoring. Sometimes the little things you can do to connect, okay? Just feel the sunshine on your skin. Listen, I like listen to your intuition, although sometimes my intuition has been variable, but be creative and use your imagination. Sit down and draw just for a little bit, even if you can't draw. Try something different. Listen to different kind of music. Do that mindfulness thing. Just don't, it doesn't take a lot of time. Work it in if you can, because it will save you. I mean, I can speak for myself and it can. And then I got Bruce and Oprah because I keep talking about them. So I may as well have a little bit of a video with them about what happens after, if you can get past some of these secondary trauma feelings, experiences.
If you take nothing else away from this experience, this conversation, I think what you and I want people to know from this book is that no matter what happened to you, It's not too late. You do have a chance to rewrite the script. And you talk about something called post-traumatic wisdom, using all of these things, experiences, good and bad in your life to allow you to have post-traumatic wisdom instead of stress about it. What does that mean?
Well, basically, that's referring to the experience where you've been able to kind of get through adversity and you're now at a safer place in your life. And you can look back and reflect and take what you've learned and use that to see the world differently. You use your pain and transform it to power and help other people. I think of the most transformative people I've ever known, every single one of them had personal pain and traumatic experience that was a core element of who they became. And it didn't crush them. They learned how to carry the burden in a way. It's not like it goes away. It's not like you're free of distress or depression or anxiety. It's just that it didn't destroy them. And it gives those people tend to have tremendous empathy for others who are struggling. And they also tend to have wisdom. They're wise about the ability to live with pain and not have so much fear from pain. It's not like you're going back and undoing. You're moving forward. I mean, that's the thing. That's the nature of the human biological system. We always are moving forward. We're changing. We may think the same, look the same, but we're always changing forward.
And I like how positive that is. Anytime you get a chance, by the way, and you want to look it up, Bruce Perry has a whole lot of YouTube videos on various topics, and he's good. He's really good. He gives a lot of encouragement. He gives some interesting brain science stuff, and he's for real. I like his approach to things, and see what you think.
If you take
I have to do this. I'm sorry. It's my silliness, but I know for us with the two kiddos that we adopted, we did a lot of silly. We really did. We did, what do you call a fake noodle? An impasta? I mean, I'm so sorry. But that kind of stuff works. It worked on the mental health unit when I was doing morning meeting with people. I would start saying that kind of, and these were people that were in serious, kind of depression states. But it's that lighthearted thing again. It isn't personal. It doesn't hurt anybody. And as long as you don't, act like you are dismissing their trauma, their feelings, it gives you a break from a lot of the intensity and the heaviness. And like I said, you get a great stink eye for middle schoolers when you do this sort of thing. And I'm all over that. So um, please remember that playfulness is one of the ways you can connect with yourself as well as with your kiddos. And I had to put this in because aren't we all trying to untangle ourselves as gracefully as we can? Because things are tangled. When you have foster kids, especially some of the stories I hear, it's like, octopus legs all kind of tangled up together about this thing and that thing and what's happened and what hasn't happened. And I really admire each and every one of you for being in that realm and working hard in it. It is, in my mind, very much worth it. And I'm very thankful to each of you, even though I don't know your situation. I'm very thankful that you took the time to be here. And I have one more thing I want to do. Just remember, if you feel burned out, it only means maybe that the candle's blown out, but let's see what we can do to light it back up. Oh, yep. And I hope that talking about this and kind of reviewing it a little bit can help you to get your spark back. And if there are any questions and comments, any thoughts about all of this, I am more than happy to talk about them. I hope this has been at least a little bit helpful to get you to think about what's going on for you and how I'm going to stop sharing and how we could do anything else to talk about this that could be helpful for you.